what is contracting for safety? Contracting for safety is essentially patient is signing a little form. It's not a legal document, but it's just a form that they fill out saying that under circumstances where, for example, they have suicidal ideation, they're gonna do X, Y, and Z. So generally speaking, these forms have, their protective factors. So for example, a very common thing would be if I start to develop these thoughts, I will reach out to my mother, and B, if that fails, I will call my therapist, and C, if that fails, I promise that I will come to the emergency department. So I think of it as essentially a checklist and how-to guide for whenever you start to have these kind of thoughts pop into your head. It's like a guide for how to act.
Right. And, at least in the literature that I've seen, sadly, it doesn't really necessarily lead to clinically improved outcomes. I think it's in a way kind of good old CYA medicine. What I mean by that is cover your ass medicine. We live in a very litigious society, right? And it's like, oh yeah, well, this patient signed this contract saying that they would call somebody when they felt suicidal. It's like, yeah, but is that actually deferring them from actually acting on those urges and those bad thoughts? And I of course have done contracts for safety. It's something I'm obligated to do in this role. Do I think it's actually having a significant, true, amazing impact on this person's lowering their suicide risk? I don't always strongly feel that way.
And it's pretty common knowledge that there's not much evidence for contracting for safety. I feel like at this point it's something that clinicians do because to a certain degree we feel like there's nothing else we can do. Obviously, a patient comes in with suicidal ideations. What can you really do in that setting, right? Our role in the ED, in the emergency department setting, when we come across patients like this, is mainly to decide disposition. And by that, I mean, are we going to hold them here in the hospital? Sometimes that means on a voluntary basis. Sometimes that can mean on an involuntary basis. Or are we going to discharge them? Are they appropriate for outpatient level of care? So those are the questions that we're trying to answer. And sometimes we feel limited, even frustrated by the lack of techniques that we can use. And, at times we can even feel like we can't do as much as we want for that patient. So Logan, I have some statistics for you. So actually, when we're talking about contracting for safety, a study found that out of people who attempted suicide and now were admitted to an inpatient psychiatric hospital, 65% of those individuals had signed a contract for safety. So those are pretty abysmal numbers, right? 65% of people admitted after a suicide attempt, they had contracted for safety. So we can pretty much look at that and say, hey, there's a very, very, very high chance that contracting for safety does nothing. Furthermore, they did a survey which included 2,000 psychiatrists, and it showed that 40% of these psychiatrists had a patient make a serious or even a successful suicide attempt after contracting for safety. So basically, we can safely say there's been enough data to know that contracting for safety has not been shown to be useful with patients who are psychotic, impulsive, depressed, or agitated. In fact, some evidence even suggests that it may be harmful for people, especially those diagnosed with borderline personality disorder.
Interesting. I mean, yeah, that last part, why harmful for people with borderline personality disorder. I wonder why. Can you offer any theories why that would potentially be harmful for someone with borderline?
Right. So when I read it, I had the exact same reaction as you, Logan, and I gave it some thought. And of course, this is just, an educated guess from having worked with actually a lot of borderline patients by this time. So my working theory is that, when we think about borderline personality disorder, these patients have really, at the core, a really hard time controlling the intensity of their emotions. And a lot of them have pretty low frustration tolerance and very poor impulse control, meaning that they're very apt to make rash kind of actions that can sometimes be very drastic. So what I imagine is when you're somebody with borderline personality disorder and you're in a position where you're starting to have these level of dysphoric feelings that reach the level of suicidal ideations, you kind of think back and you remember the promise that you essentially made your doctors. And I feel like that level of responsibility may even contribute to that feeling of dysphoria, that the feeling that they might let somebody down. And at the core of it, why do patients with borderline personality make impulsive and rash decisions that sometimes take the form of suicide attempts. It's because they're unable to tolerate that intense emotions of dysphoria, right? So that they act out. They act out in a way that's going to distract them from that core feeling. So it might be a case where that contracting for safety is adding to that level of commitment that they feel, and having these kind of negative emotions, there's an internal conflict there. And that's more likely to lead them to a place where they're going to act out in a drastic way so that they can take their mind off of the commitment that they made. You think that's reasonable, Logan?
I think that was actually extremely well put, and I'm glad I made you answer that question, because I would not have answered that question as well. So,
well, that's not fair, because I thought about it before. That's the only reason.
Right.